exemption for households and promoting solar alternatives to bring down costs. Let me just pause here briefly to let you know one of the reasons that we started a bit late was I was out there trying to appreciate how Ghanaians are embracing the electronic vehicle or the electronic bus public transport system that Dr. Bawumia promises in the manifesto, yet was commissioned today. Driving from the airport, I saw the bus on the streets and how Ghanaians were enchanted by it. This is, ladies and gentlemen, a fulfillment of a promise that was supposed to start from 2025. For me, the takeaway from that commissioning today is the fact that Dr. Mahmoud Bawumia is committed, and everything he's saying he believes can be done and will be done. And that, for me, for those who are listening and those who have seen the bus, it is a testament that our choice is clear. Our choice of who we bring in to lead Ghana here on is very clear, and we cannot equivocate about it. We cannot wonder who we want to lead this country from January 7, 2025, because we have a man who has demonstrated with the least office given him, least in quote, as the vice president of the country, and what he has done with that to suggest to us that if given more, he will do exceedingly well with that office. Yes, this afternoon, the electronic bus, if you heard about it, that manifesto is alive in Ghana, it's working, and very soon, if you take the opportunity, you'll enjoy that, and it'll be cheaper. And more of it will lead to lower cost of transportation and cost of living overall in our country. Health infrastructure expansion. The Bawumia plan will enhance healthcare access to rural population, increase NHIS enrollment for underserved communities, and increase investment in healthcare infrastructure and services. That is key. And as most of you know, owing to my recent misfortune, I've become very, very interested in healthcare issues. And I think that Bawumia administration will be good for Ghana in terms of its investment in the healthcare sector. A central piece in ensuring access is the spirited completion of the Agenda 111 hospitals and the addition of significant numbers of CHIPS compounds and health posts to boost primary care access, especially in rural communities. Job creation initiatives. The Bawumia plan will address unemployment by creating millions of jobs through entrepreneurship, digitalization, ICT skills development, and industrialization. And I did mention earlier about the One District, One Factory. And also, those of you who are familiar with our manifesto, we've talked about it here at the previous press conference about a plan to create 1 million jobs in the IT space, which by and large will position Ghanaian youth globally to be able to access IT jobs right here in Ghana without necessarily having to move. Those jobs are available. What is necessary is the election of His Excellency Dr. Mahmoud Bawumia and a deliberate investment to create those opportunities for our young people to take advantage of that opportunity that is already out there. Enhance social interventions. The Bawumia plan is committed to expanding the free SHS, as I indicated earlier, and livelihood empowerment against poverty to cover more vulnerable groups. And you know, I stand to be corrected on numbers, but since we came to office, we have expanded the LEAP program almost by 100% in terms of the payout and in terms of the numbers. And His Excellency Dr. Mahmoud Bawumia is committing to intensify that, not only in terms of the payout, but expanding the groups that should benefit from that program. But all in all, an understanding that the government must be there for its citizens, and Dr. Bawumia is committed to doing that for our country and our people. This initiative will include targeted support for women, children, and persons with disabilities. Gender empowerment. Bawumia administration is committed or will be committed to gender equality, including promoting women in leadership and supporting female entrepreneurs through tailored financial and technical assistance programs. Expanded access to healthcare system. Dr. Bawumia's vision for Ghana's healthcare sector is to build an inclusive, technology-driven system that ensures equitable access to quality healthcare services for citizens, for Ghanaian citizens. His health policy will address the sector's long-standing challenges, such as inadequate infrastructure, staffing shortages, compensation, motivation for higher specialization, job satisfaction, and outcomes for patients. Dr. Mahmoud Bawumia's plan will significantly improve Ghana's healthcare infrastructure, access, and delivery. The cornerstone of the plan, again, as I mentioned this earlier, is the Agenda 111, the unprecedented investment in health infrastructure this country has ever seen since independence. It will continue that investment and ensure that the health infrastructure base of our country is sound and solid to take care of our growing healthcare needs in the country, and perhaps set us up as a hub for medical tourism in the sub-region. The plan will add, just for information, I'm sure you know this, the Agenda 111 plan will add 101 district hospitals and 6 regional hospitals in the newly created regions. When completed, they will provide high-quality healthcare at the district level to ease the pressure on tertiary hospitals like the Komfo-Anokye's and the Kolebu teaching hospitals, among others. And those of you who are conversant with these hospitals, the big hospitals, they have the pressure coming to them because most of the primary level hospitals are mostly not able to absorb that. But if you have a situation where we have all these 101 district hospitals come on stream, it would completely alleviate that burden on these big or tertiary hospitals to ensure that they focus on their teaching and research mandates. Modernization of existing facilities. Regional and district hospitals will be renovated and upgraded to provide state-of-the-art equipment and facilities for specialized care. The centralized electronic medical record system will be expanded to ease data management challenges and facilitate patient care and referral management. Establishment of new hospitals. The Bawumia plan will intensify the building of new hospitals, new health facilities to underserved communities. And I mentioned this earlier, mainly in rural areas, to reduce the travel time and cost associated with accessing healthcare outside their immediate environment. It will also deepen the provision of free maternal health care, child immunization, and nutritional support for pregnant women and infants. The provision of specialized centers of excellence. To reduce dependence on foreign medical treatment, the Bawumia administration will invest in specialized centers for advanced care, including cardiology, oncology, and nephrology. Focus on primary health care. Strengthening primary health care facilities to handle basic medical needs, thus reducing the burden on tertiary hospitals, I just mentioned some of them, Komfo-Anokye's, Kolebu, and some of the regional teaching hospitals. This effort will ensure the deepening of digitization of the National Health Insurance Scheme to enhance access, eliminate fraud, and ensure timely reimbursement of service providers. Training and retention of health workers. increasing investment in training programs for doctors, nurses, and allied health professionals. This initiative will offer scholarships and incentives to encourage specialization in high-demand fields and ensuring equitable distribution of healthcare workers across the country, particularly in rural and deprived areas. So the use of incentive and enhancing job satisfaction for medical professionals will be escalated and ensure that the environment is conducive and that they can stay and serve their communities for the overall health of our economy and our countrymen.